And joining me now is Eve Weissman, who is the Healthcare Campaign Coordinator for New Jersey Citizen Action, and Jeffrey Weingarten, who's president of the Morristown Tea Party organization. Welcome to both of you.
Thank you.
Eve, why do you support the healthcare initiative?
We support the healthcare initiative because healthcare reform is something that this country sorely needs and has needed for a very long time. Healthcare costs are simply too high. They are crushing families, small businesses, and state and federal government. Across the country, people are losing their health coverage or getting denied claims or kicked off their health care plan when they get sick. And more families are just finding that they simply can't afford the escalating cost of health care. So we support health care reform because this is a strong health care bill that has been proposed in various versions in both the House and a version in the Senate that will go a far way in lowering cost, in providing everybody with access to good quality, affordable health care, and providing people with choices, the choice of the doctor that you want to see. Require that everybody has access to good quality health care. So we think it's a strong bill and that the vast majority of people support it, and we need to get it passed.
What are your concerns?
The financier Warren Buffett has said, if you don't understand it, don't sign it. Congressman Conyers, a Democrat, has said, read the bill. I don't understand the bill. It's over 1,000 pages. It would take 2 days and 2 lawyers. That's one of the biggest concerns why a lot of people think that they should burn the bill and start again. And this is a practice for the National Town Hall that's going to be held on 9/12 in Washington, D.C. Information is at www.njteaparty.com. That's when we're going to let the entire country know how we feel about this and other practices that have been coming out of Washington.
Now, both sides have been mobilizing on this whole effort. Eve, what have you people been doing to try to get your word out there and to get the people at the grassroots level involved?
Sure. Well, there has been an outpouring of grassroots support in favor of the health care reform bill across the country and here in New Jersey.
But you don't really hear that at these town hall meetings.
Well, I think that we're going to start to hear it more. I think that part of what's happened is that many people who came out during the election, who supported the current administration and the current Congress and voted them in largely because of health care reform. It was a huge issue during the election. I think that a lot of people, quite frankly, didn't realize the type of smear campaign and attack campaign that was going to come from the insurance companies and those who want to kill health care reform. And we're simply unprepared for it. But across the state and certainly across the country, there's been a huge amount of activity. In fact, just last weekend, there was a canvass down in South Jersey in Willingboro where we had over 50 volunteers knocking on their neighbors' doors, asking people to sign a petition in support of the health care bill and to call their congressman, Congressman John Adler, and ask him to support the bill and make sure we pass a strong health care bill when they go back to Washington. And there's similar events coming up. There's an event on the 23rd of August, an event on the 30th. So we're going to be seeing a lot of grassroots activity amping up for health care reform over the coming months.
Jeff, you guys sent out emails to people. Now, were you surprised at the large turnout that you had?
I was very gratified at the large turnout. A lot of people at our meetings and phone calls have expressed their dissatisfaction with what's going on. Polling has showed that recent Rasmussen polling has shown that more Americans are afraid of the government than they are of the insurance companies, and are 57% to 32% opposed to single payer. So we did show one of the congressmen who has had the town hall meetings, Congressman Steve Rothman. To his credit, he has come out and said that he would oppose the bill, the health care bill in its current form. There are too many provisions in it that he, in good conscience, cannot vote for.
It's very complex. Have either of you read this bill?
I've started to read it a number of times, and I think it's just incomprehensible, and that's one of the problems.
The bill is very complex, and it's certainly very large. To tackle a problem as complex as health care reform, it certainly needs to be. I think that what's important is that there are very intelligent, dedicated people, both members of Congress and their staff, and staff of other organizations, who have read through the bill very carefully. And
how can you both, though, advocate a position on this if you can't really understand the bill?
Well, but I think there is a way to understand the bill. I think what the bill lays out in many ways is very clear, and I think that there's a lot of misinformation, and I think there's a lot of lies out there about the bill. I work closely with people who have read it because I work in an organization where people have different roles. Some people's role is to organize and to be a grassroots organizer, and some people's role is to be more involved in a more policy type way and to understand a specific bill. But look, I mean, the bill is written. It is a written document. So to sit and debate what it says or what it doesn't say, we can have a debate on the merits of health care reform and whether or not government should or should not play a role in health care reform.
For both of you now.
The bill is written, and it's pretty clear what it says.
I want to throw something else out here for both of you. I've gone to a number of these town hall meetings, and one thing that I was struck by is the lack of minorities in those audiences. What's going on there? Why am I seeing that?
I think that's a really good point. I think that, again, we are out there working to organize people and mobilize people to let them know that this is not a given. I think that a lot of people, I think that this last election was a referendum to say that the people want health care reform. We want to take this country in a different direction where we have a government role in health care to make sure that keep the insurance companies honest, lower costs, and provide access to care. I think a lot of folks just didn't realize and are only starting to really understand the amount of fear and frustration that's
last
out
word
there.
from Mark. Why am I seeing no minorities in those groups?
We have minorities that come to our meetings, and I quite frankly see minorities at the town hall meetings, and I think you're going to see a lot more in Washington because on 9/12 because a lot of people are really upset at having been ignored, at having been marginalized, and they want their voices to be heard.
Okay. Thank you both very much.
Thank you.